Good afternoon. Welcome to the António Champalimaud Vision Award lecture at ARVO. We are here now celebrating our 2023 award. Like always, at ARVO, we present the awardees of the previous year. This is relevant because in odd-numbered years and in even-numbered years, the Champalimaud Award is given to different kinds of work. So it's relevant to know whether we are in one or the other situation. So this time it is the 2023 award. I am very happy to be here with you in this ARVO community for what is this year a very poignant occasion. The challenges facing our 2023 Champalimaud Award winners have changed dramatically in recent months. You probably recognize the picture which is being shown. They changed dramatically since they were chosen as awardees, and they changed dramatically since the awardees were announced last year in September in Lisbon. The opportunity for me to introduce them to you today gives us a special moment to remind ourselves of the real core purpose of the work that we do. For Champalimaud Foundation, and I believe for all of you here today, this is a particularly special event. Before going any further, however, I would like to offer some words about the context of this meeting. The relationship between Champalimaud Foundation and the ARVO goes back to some of our earliest days as an organization. It's almost exactly 18 years to the day since I joined Larry Takamoto and had the pleasure of introducing Champalimaud Vision Award to the scientific community at ARVO. That was in 2006. Since my first visit, I have returned to this meeting almost every year, and I have been inspired by many of the things I have heard here. I always leave having learned something new and having had the opportunity to connect further with the ARVO leaders and membership. May I mention here the special relation I have built with the women who have been presidents of ARVO, my friends Martin Yeager, Justine Smith, Emily Chu, all receiving awards and recognitions in this occasion. And this year also, Patricia D'Amore, who happens to be also a former laureate of Champalimaud Vision Award. By the way, I am also very happy because next year, the president-elect, Professor Sada, I could meet him earlier at the LVI Prasada Institute in Hyderabad. I look forward to continuing to have this special relation between ARVO and Champalimaud Foundation. The theme for this year's ARVO meeting could not be more relevant. Technology and AI are areas we can't help being confronted with every step of the way, especially when healthcare fulfills our lives. Our Vision Award has already been able, on its early days, to recognize achievements in development of new technologies to transform eye care. Indeed, we are now at the beginning of what feels like a revolution in the way we can diagnose and treat disease. Within my institution, Champalimaud Foundation, we are utilizing many of these new technological tools within our areas of cancer and neuroscience. Some of us still use paper for our speeches, though. I may say that it is the privilege of age. Please accept it as such. AI is very much a feature of our work. with its growing application both for diagnosing and treating. In the picture, you can see some people preparing breast surgery using AI, and then now a surgeon scrutinizing the structure of the breast he's about to operate on using three-dimensional pictures generated by AI. Well, that's just an example. Actually, already in 2019, and to our great surprise, Champalimaud Foundation was ranked 4th by Nature among NGOs in the area of life sciences using AI. It was a big surprise for us. We had no idea that we were at that point. And in neuroscience now, we look forward to opening the newest part of our campus, which will be dedicated specifically to harnessing this type of technology. In our new Center for Digital Therapy, we will bring together professionals from many different disciplines to utilize these new technologies, including to provoke behavioral changes that maximize health outcomes. We have been taking many initiatives also to make people understand the possibilities that lie in the use of AI and all the issues which are relevant in that use. This is a picture of a series of events we have been organized for the general public with this type of purpose. There was one today, which is being shown now, actually in the evening in Lisbon, so which I attended online earlier because of the difference in time. While we are fortunate to live in an age when technology has a truly transformative power, these tools are only useful if applied in the correct way. This is the main reason why the European Parliament recently became the first major political body in the world to introduce new regulations concerning the use of AI. Those regulations were discussed today in the meeting I just mentioned. So that is the president of the European Commission visiting the Champalimaud Foundation some time ago. For us, this means that everything at our disposal must be focused on one outcome: improving the lives of patients, wherever they may be. It is relatively easy for patients to find our institution in Portugal and have access to some of the most advanced health technologies. But for people living in more disadvantaged parts of the world, the situation is, of course, very different. It was for this reason that we launched the Champalimaud Vision Award in 2006, with a view to improving eye care and recognizing the achievements of those who deliver it. In developing a prize that can reward both outstanding scientific breakthroughs and clinical delivery in the developing world, we have been fortunate to count on the support of our jury members. Our jury comprises some of the most celebrated scientists, physicians, and humanitarians anywhere in the world. Each has brought a singular perspective to bear each year on the process of selecting our winners. I owe a debt of gratitude to each of them for working so hard each year to find the very best work in the field. I reserve a particular word of thanks to the chairman of our award jury, Alfred Sommer. Unfortunately, he couldn't make it here this year, but I very much hope that he will be with us back next year. I am delighted, however, to be joined by Paul Thieving, who once again represents the award jury in Al's absence. I am sure that for the ARVO members, Paul needs very little introduction, except for me to say that we are honored to count him as a partner, advisor, and friend. With the help of Paul and his fellow jury members, we have since 2006 celebrated the achievements of a diverse and remarkable group of scientists and public health workers. In even-numbered years, we recognize outstanding research breakthroughs. In other numbered years, the prize goes to organizations who bring high-quality eye care in the most remote or disadvantaged parts of the world. Those involved in this work believe that no patient should ever go untreated. The medical, logistical, and humanitarian work that has been done by our laureates to deliver eye services across India, Nepal, Bangladesh, Brazil, and much of Africa is astonishing. Each of these projects is inspirational and showing the capacity that we as humans have to help each other in times of need. But until last year, our world had not reached an organization working at the front lines of a historical conflict zone. With this in mind, the winners of the 2023 Champalimaud Vision Award hold a very special place in our list of laureates. Sustaining high-quality clinical care in parts of the world which lack infrastructure as well as social or political stability is a considerable challenge. This is particularly true in regions with a history of conflict or unrest. Now, more than ever, it is worth celebrating the incredible impact and importance of the St. John of Jerusalem Eye Hospital Group. This unique organization has been the only eye care hospital consistently serving people in East Jerusalem, the West Bank, and Gaza for the last 140 years. Without their presence, blindness would be rampant throughout this region, adding to the extremely challenging economic conditions. Over the past decade, they have treated the eyesight of hundreds of thousands of people, regardless of ethnicity, religion, social class, or economic capacity. In 2022 alone, 143,000 patients were reached and 6,900 major surgeries were performed. In addition to this clinical work, St. John carries out important research on the causes and risk factors for eye issues unique to the region, as well as training of eye care providers from the local population. All of this takes place in one of the most challenging political regions in the world, and where the prevalence of blindness is 10 times higher than in the West. That we have members of this organization here with us today is an emotional moment in the history of Champalimaud Vision Award. Indeed, I offer them my deepest thanks for having overcome so much in order to travel to Seattle this week. I'm referring Ahmad Maali sitting here and David Adai sitting over there. There are some images of Ahmad Maali with the President of the United States, with co-peer at the Hadassah University in Israel, and with our President of ARVO, Patricia D'Amore, in Lisbon in September. In light of the ongoing conflict in the region, their work is a reminder that healthcare is and should be politically neutral. Wherever there is conflict or instability, there are people suffering from disease who are unable to access the help they need. In the West, this is perhaps something we are used to take for granted. We know where our hospitals are and how we can access them. This is not the case for so many people in other parts of the world. When this is then combined with violence, a difficult situation becomes truly desperate. As we listen to the words today of our 2023 Vision Award winners, I, for one, will reflect on how it is the mission of all us in healthcare to offer diagnosis and therapy in a way that is without judgment. You are seeing a picture of the ceremony in Lisbon last September, and I want to tell you that this ceremony was attended by the Israeli ambassador in Lisbon and by the representative of the Palestinian Authority. It is, for many reasons, for me an honor to introduce St. John of Jerusalem Eye Hospital Group as the 2023 Champalimaud Vision Award laureates. I normally close my speech here by reflecting on my pride at being a part of this ARVO community. I feel this more strongly than ever and continue to be inspired by my time here each year. But as I welcome our award winners to the ARVO meeting, this feeling is mixed with a sense of responsibility. A responsibility to never forget the patient in everything we do in biomedical science, and a determination to learn from those who work truly at the front line in offering help to those facing the greatest needs. Thank you.
Thank you. Good evening, everybody. Thank you, Madam President, for this introduction and for the kind words. It's a bit nerve-wracking to be standing here in Seattle at the ARVO meeting, but it's also a pleasure and an honor for me to be standing here to present the work of the St. John of Jerusalem Eye Hospital Group as the winner of the 2023 Antonio Champalimaud Vision Award. I will seize the next maybe 15, 20 minutes and this fantastic opportunity and talk to you about the St. John of Jerusalem Eye Hospital Group, our history, our origin, our work in the Holy Land, our impact on the people we serve, as well as our future plans. So if we talk about the history of St. John of Jerusalem Eye Hospital Group, the St. John of Jerusalem Eye Hospital Group was the first hospital to be established in the Holy Land and also in the whole of the Middle East. It was first established in 1882 in East Jerusalem, and it was established on orders from Queen Victoria of Britain at the time, who gave the orders to establish the hospital and granted the hospital a royal charter. After 141 years, we remain the main, if not the only, charitable eye care provider in the Holy Land. Our mission and our vision have not changed since the hospital was established. Since it was established, our mission was, and still is, that we exist to provide ophthalmic eye care of high quality to the people residing in the Holy Land, regardless of their race, religion, social class, or ability to pay. We continue to strive to eliminate avoidable causes of blindness and be recognized as a leader in the provision of a quality eye care, as well as medical clinical education in Jerusalem, West Bank, and the Gaza Strip. Who do we serve? We actually serve everybody who needs us. And if I want to be very honest with you, those who need us most, or need our services most, are the Palestinians, or 5.2 million Palestinians residing in East Jerusalem, as well as West Bank and the Gaza Strip. However, we don't refuse to give service to anybody. On the contrary, we have patients who come to us from the west side of Jerusalem, so we have some very few Jewish patients also who come to us, so we serve Muslims, Christians, and Jews as well. 78% of the Palestinians who are residing in Gaza are refugees who are dependent on food and financial handouts from the various UN agencies. there are around 700,000 refugees as well who are residing in East Jerusalem, West Bank as well. I'd like to spend a few minutes talking to you about the context within which we function and some of the barriers that people face in their endeavor, if you like, to seek equitable eye care. As you may know, we live in a small geography. However, this brings with it a lot of complex political problems and barriers to equitable eye care. I'd like to mention only a few barriers to equitable eye care. Physical barriers. Due to the ongoing political turmoil that the country has experienced for so many years, there are some man-made physical barriers to equitable or that hinders access to eye care. The concrete wall that separates Jerusalem from the West Bank, as well as the security checkpoints in the West Bank, mean that only those who are eligible for permission or for permits are allowed into Jerusalem. Negotiating checkpoints and complex permit systems prohibit many from seeking eye care at the hospital or at the Jerusalem hospital. Socioeconomic barriers. More than 35% of the people we serve are below the poverty line. Unemployment is extremely high, both in the West Bank and in Gaza, reaching 60% in Gaza, that is before the war. This dire economic situation that makes private for-profit eye care beyond the reach of so many of our patients. Awareness and knowledge barriers, genetics, poor diet, poor lifestyle, all have led to almost 15% of the population suffer from diabetes. First cousin marriages is very prevalent as well. All of these have contributed to increasing the prevalence of blindness amongst the population we serve. The Palestinian healthcare system is relatively young, new. It was established in '93, but it still suffers from multiple healthcare providers who have little coordination between them and little cooperation as well, and no governance almost. There are insufficient qualified human resources in the health system, as well as there are shortages of funding as well. Our relevance in the Holy Land. So why do we exist in the Holy Land? Blindness amongst the population we serve is almost 10 times than the people living in Western countries. From the rapid assessment of avoidable blindness that we conducted, a study that we conducted in 2019, it revealed that the prevalence of blindness was 2.6% amongst the population, as compared to 1.2% in neighboring Jordan. However, the prevalence of blindness in Gaza was 5%. The leading cause of blindness was cataract at 38%, followed by diabetic retinopathy and refractive errors. However, in Gaza, diabetic retinopathy was the leading cause of blindness at 32% for those over the age of 52. So what has been our strategic response to all these barriers? The hospital's strategic response to all the mentioned challenges and barriers and obstacles to the provision of eye care meant that we needed to take services to the people, especially those who are not able to reach us for whatever reason. As a result, we have become a group of hospitals and satellite centers. We now operate from 6 sites that are purposely located to ensure that maximum reach for the target population. We have the Jerusalem Hospital, which is the mother hospital in the East Jerusalem. We have a clinic in the old city of Jerusalem. And also, we have a hospital in the southern part of the West Bank, which is the Hebron Hospital. We also have a center in the middle called Kfar Aqab Clinic or Kfar Aqab Center. And we have also another center in the north of the West Bank. In a few months' time, we will have a hospital also running in the West Bank from the Nablus city. As for Gaza, we have the St. John Gaza Hospital. With regards to our services, we provide, or the group provides, comprehensive ophthalmic services that includes all subspecialties. The Jerusalem Hospital focuses mainly on tertiary eye care in addition to training and research. Ocular oncology is a subspecialty that we don't have at the hospital, but we have this covered by our colleagues at the Hadassah Hospital. The impact of the hospital on the population we serve, these graphs just show the number of patients that we have served over the last 10 years. You can see that we have operated on more than 60,000 patients, moving up from 4,000 in 2013 to almost 7,000 in 2022. There was a decline, of course, last year because of the war in Gaza. As for outpatients, we treat on average 140,000 patients annually, and we conducted more than 1.4 million outpatient consultations in the past 10 years alone. 35% of those were children. We don't only focus on quantity, but also on quality services as well. We have invested heavily in the capacity of our staff, who have become very well-trained, and we worked closely with colleagues from Hadassah, Beersheba, Afula Hospital, and others to ensure that our clinical staff are very well-trained and equipped to provide the best care possible. Our Jerusalem Hospital was the first hospital in East Jerusalem to receive the prestigious Joint Commission International accreditation in 2013. As a result, we have become a center of excellence and patient safety, as well as Center for Training Education in East Jerusalem, West Bank, and Gaza. Other initiatives or other interventions, if you like. In addition to the primary, secondary, and tertiary eye care the hospital provides, or the hospital group provides, we have also been leading a number of programmatic initiatives that aim to combat avoidable causes of blindness at the community level. These include community eye care programs, strengthening existing healthcare systems, ophthalmic capacity building, and innovation. Community preventative programs, we provide mobile ophthalmic outreach services both in the West Bank and in Gaza. And we focus mainly on the most isolated and neglected communities like refugee camps and Bedouin communities as well. As part of the program, we also conduct diabetic screening, diabetic retinopathy screening using handheld fundus cameras. We have introduced the first retinopathy prematurity screening program in the country using, again, unital fundus cameras. More than 20,000 patients are screened and treated every year by the outreach teams. Child vision screening program is also another initiative at the community level, and it's been undertaken by the hospital. We screen vision, or the vision of those between 3 and 6 years old, for refractive errors, amblyopia, and other ophthalmic abnormalities. This year so far, we have screened more than 30,000 children, the vision of more than 30,000 children, and we have referred almost 11% of those to the hospital for further investigations and/or treatments. By doing so, we are able to treat amblyopia, refractive errors, as well as improve the quality of the lives of the most disadvantaged children in the country. We also strengthen healthcare systems, existing healthcare systems. We take a leading role in the field of ophthalmology and train primary healthcare providers to screen for blinding eye diseases such as diabetic retinopathy, and also teach them how to refer these patients for further treatment and management. This year, we have trained more than 130 primary care clinicians, mainly doctors, in this area, and therefore, by doing so, we have managed to integrate primary eye care in the service provisions that are provided by the United Nations Relief and Works Agency in the West Bank, as well as Gaza. Teaching and training. We continue to lead ophthalmic training and teaching in the country. We offer a 4-year medical residency training, and so far have trained more than 50% of the practicing ophthalmologists working in Gaza and the West Bank. The hospital is also the only provider of ophthalmic nurse training, and so far we have trained more than 140 ophthalmic nurses in the West Bank and East Jerusalem. When students are unable to reach us, especially those from Gaza, we take faculty and training to them. And so far, we have trained more than 50 ophthalmic nurses for Gaza. For many years, as a charitable eye care provider, we focused our services on service delivery, or our provisions on service delivery only. However, for the last few years, we have been looking at research, strengthening our research capabilities and training. In collaboration and full partnership with our colleagues from the Hadassah Hospital, we have established the first ophthalmic genetics laboratory to serve the population in the West Bank, East Jerusalem, and in Gaza. We continue to collaborate with colleagues from Hadassah, local colleagues, international colleagues, and we have published a number of peer-reviewed papers in this field as well. Anybody who's watching the news in the last few months would know that the situation in Gaza is really very difficult, and therefore I'd like to say a few words about our work in Gaza. Our intervention in Gaza started about 33 years ago. Our hospital is situated in Gaza City and was purposely built in 2016 to accommodate comprehensive eye care services, including outpatient department, diagnostic department, daycare unit, as well as an operating theaters. Before the war, we provided almost all ophthalmic subspecialty services for the people who are residing in Gaza. We also run an outreach service to the most vulnerable people who, with special focus on elderly and those who are disabled. We treat in Gaza around 40,000 patients annually, and we undertake some 3,000 major eye surgeries as well. Now, the current situation in Gaza, as we all know, is quite difficult, and the hospital is situated in the city of Gaza, and we needed to evacuate the hospital at the start of the war, and where our staff had to move to the southern part of the Gaza Strip. Unfortunately, the hospital remains dysfunctional, if you like, since October 8th, 2023. As a result of the war and related hostilities, the hospital has sustained some collateral damage during the war. Medical response in Gaza during the war, as you may know, there are about 1.2 million people, maybe 1.3 million people, who are displaced and are residing in the southern part of the Gaza Strip. These refugees have unmet ophthalmic healthcare needs. We have initiated a 3-phase plan to respond to the needs of our refugees. Although Gaza remains at war or remains a war zone, but we have decided to implement these plans forced by the huge demand for ophthalmic services. Phase 1 focuses on primary eye care, treatment of eye infections, eye inflammations, treatment of glaucoma, wound care, and basic suturing of lacerations, and some public health interventions. Phase 2 will focus mainly on diabetic retinopathy treatment, and phase 3, we hope, will be able to accomplish this by the year end, and will involve rehabilitation of the hospital and recommencement of surgical interventions. Phase 1 of our intervention has started, and we provide primary eye care interventions at 4 locations in the south, middle, and the north part of the Gaza Strip. Every week, our teams treat between 1,000 to 1,500 patients and provide their medications as well. One would say, how much does it cost to sustain a group of hospitals? Briefly, I'd like to say that to sustain the group of the hospitals and clinics we have, we need around 15 million US dollars. We generate almost 40% of our operational budget from patients-related income. That includes Israeli Ministry of Health insurances and Palestinian Authority insurances and UNRWA, which is the United Nations Relief and Works Agency insurance. 40% of our budget comes from voluntary donations. 19% or almost 20% comes from the worldwide St. John Priories, mainly the St. John Priory in the USA. This is why we are here. For 140 years, our hospital has been providing charitable eye care to those who need it. We have saved the sight of so many of our patients and therefore have positively influenced and even changed their lives. In 2023, we were honored to receive the prestigious Antonio Champalimaud Vision Award. This international recognition of our work has and will strengthen our charitable ethos and resilience and will enable us to reach more needy patients in the country. The award will be of great help to us as well to continue build shattered lives of those traumatized by war. After all, it's hard to look to the future if one cannot see it. And finally, I'd like to say that I hope that I've been able to give you some snapshot of the work we do in the Holy Land. And I'm sure you all join me to pray for peace in the whole world, but mainly at the moment in the Holy Land. Thank you so much. Thank you.